So in a quick summary of the case study, a girl decides to get a tattoo, right, and doesn't turn out so good for her. So she experiences some symptoms. She has swelling, edema, right? Could this be an allergic reaction?
Yes.
Yeah. She experiences, oops, my things are out of order. Heat, right? Could that be an allergic reaction?
Yes.
Right? Erythema, redness.
Yes.
Yeah, we talked about this today. And then after a couple of days, right, she went to the health center. They gave her Benadryl, right, an antihistamine. So if it's an allergic reaction, hopefully it should be going away. Instead, it's getting worse, right? The swelling's increased, it's hot, it's even itchy now, and it's red, right? So, but in truth, they're saying symptoms here, right? But symptoms and signs can be distinguished from one another. Does anybody know what a symptom truly is?
Subjective.
It's subjective. It's something that only the person experiences. Someone looking at them wouldn't necessarily know they're experiencing this. So
Pain is a good example.
most of these are signs and symptoms that are common with inflammation, right? That we've talked about, right? The swelling, the heat, the redness, right? All of these
The itching.
could be inflammation. And do we experience inflammation with allergy? Yeah, you do. So, but which of these are signs and which are symptoms? So a symptom, as we said, is subjective evidence of a disease, while a sign is any objective, right? So a symptom is a phenomenon, right? So as Carol said, a headache, right? So when we look at this list, which one is a symptom and not a sign, something we would not be able to see? The itchiness. The itchiness. I mean, you could see somebody scratching, maybe assume, right? But you don't know for sure, right, that they're truly itchy. Okay? Itchy, headache, pain, right? These are all things that you experience, but we wouldn't be able to look at you per se and know for sure what you're experiencing, right? We could assume. And so the tricky thing is if you're going to be a veterinarian,
Animals can't talk.
no symptoms, just signs. Right? Which is kind of good because sometimes symptoms can kind of throw you off, right? Probably in this case too, right? Might be throwing it off a little bit. So what is inflammation, right? It's a protective response of our immune system to get the white blood cells there, right? Why does it happen? What's the purpose, right? We're trying to contain a pathogen. We're trying to repair damaged cells, right? Could this be because you have an infection?
Yes.
Could you see this with allergy?
Yes.
Could both be going on?
Yes.
Absolutely, right? So we've got to try and tease out what's the cause, right? So what are ways that we're going to figure out the cause? So one of the things, right, they immediately thought Benadryl, right? Gave an antihistamine. That would work if we're talking about an allergic response because what Benadryl is an antihistamine. It's going to compete with those receptors on the cells, bind to the cells so that the histamine can't bind, right? And this is why it's important for those of you that have allergy to take this before, if you can, potential exposure, right? So if you're going over to a friend's house and they've got a cat and you're allergic, take your allergy medicine now, right? If you're allergic to stuff outside, take it before you go outside, right? Take it every day if you have to, right? I had a colleague of mine, she was allergic to dust, right? She didn't like taking her allergy medicine and made her drowsy, right? I was like, take it at night. You're going to sleep anyways. It's a 24-hour pill. It'll still be working when you get up in the morning. You're allergic to dust. You work at Delgado. There's no way you're going to get away from it, right? There's no way. And one of the reasons why, specifically why Benadryl makes you tired, is it blocks acetylcholine. So it acts as a sedative. So histamine induces capillary dilation, right? So part of the inflammatory response. Increases the permeability too, right, for the inflammation to happen. Lowers blood pressure because of the dilation that happens. Constriction of most smooth muscle tissue. It can increase gastric secretions, and it can even alter the heart rate. There's 2 different types of receptors found on different cells. Actually, there's 3 different types of receptors. The one that's targeted typically by Benadryl is the H1 receptors, which cause contraction of smooth muscle and capillary dilation, right? So we're trying to combat that problem that histamine causes. I don't know what's wrong with me this morning. Okay. So where does it come from, though? So in our body, we're releasing histamine. So this is kind of review from today's lecture. Where'd they come from? From the basophils and mast cells, right? So they're releasing that, remember, when they've been triggered by an antigen, or in this case, if we're talking about allergy, an allergen. Where are they found in your body? They're all over, but they're definitely concentrated in your mucosa and epithelial tissues near small blood vessels. So of course it affects those small blood vessels immediately when it's released too. This is why it can literally happen very quickly. It's also in the subendothelial connective tissue. So yeah, pretty much all over. So whenever you read and you run across something you don't know what it is, what should you do? Look it up, right? So what is centripetal pattern? What is that referring to? Typically, this is an inward pattern of spread. What they mean by inward here is that it usually starts at one's extremities and heads towards the trunk of the body. All right, so they're having this situation, right, where it's basically spreading outward, right, for her. So she goes to the health center because it's not getting better, right, and the doctor the attending physician just hammers her, right? He prescribes anti-inflammatories, a different antihistamine, a broad-spectrum antibiotic. So why is he doing all this? Well, let's take them one by one. An anti-inflammatory. Why would you want to stop inflammation?
Slow down the reaction.
Right. Clearly, the inflammation is not taking care of the problem, right? And prolonged inflammation can be damaging, right? So at this point, right, it may be causing more harm than it's helping, right? So we might need to quiet that down a little bit. Why a different antihistamine? Well, the one that they're giving her isn't working, right? And because that particular one works in a particular way, we discussed, right? So do all antihistamines work in the same way? No, right?
Zyrtec work different than diphenhydramine.
Right, so different ones work different ways. So not all histamines work in the same way, right? So let's try a different one that works in a different way. What's a broad-spectrum antibiotic?
It covers both gram-positive and gram-negative.
Right, covers both gram-positive and gram-negative, right? So a wide range of bacteria, okay? So typically, what type of infections are we giving antibiotics for? Bacterial infections, right? So he's thinking it could be a bacterial infection, right? Why collect skin scrapings and look at them under the microscope, and why would you culture that?
To find out if something's growing, and if it is, what it is. So
Right.
that you can figure out how to treat it properly.
Right. So is it there, right? Is there something there, right? Can we find it? Can we see it? Can we grow it? Can we identify it, right? What is potentially there, right? Get to the cause, right? What is the potential cause? So if it is an allergy, it must be infection, right? Those are our two choices. So she could be having an allergic reaction, right? Hence still another antihistamine, right? But the doctor also needs to rule out infection, right? And so right away, bacterial, right? He's looking at, but wide range, right? Gave her a broad spectrum antibiotic. So he's like, I'm not taking any chances. If you're gram-positive, gram-negative, I'm going to get them all, right? And then still look and make sure, right? And which was good in her case because it wasn't any of those things. And also, since he found out, right, where she got her tattoo, we sent the health center there to investigate, right? Because the tattooing process itself, right, is creating a wound, is it not? Right? They're actually using needles to penetrate dye into your skin, deep into your skin. So the instruments themselves need to be clean, right, from person to person, and sterile, right? Because otherwise you are injecting stuff in. The skin itself, is your skin sterile?
No.
No. So the
It's
skin has to be disinfected as best it can be, right? So you're not introducing any normal flora from the skin deeper into the skin, right, when you're puncturing the dyes in. And then after the tattooing process, right, again, it's a wound that you're creating. So it has to be treated as such. It has to be kept clean. It has to be monitored, right, for the possibility of secondary infection. A lot of times I think they put triple antibiotic ointment on, right?
Yeah, the first
To
year
prevent-
is usually that, and then it's like
Yeah.
A&D ointment after that, just to keep it moist.
Moist, right, because again, you've got a wound, right? So it's wound care, right, afterwards for the individual. So after 48 hours, the cultures really are just showing gram-positive cocci and some thin-walled hyphae. So they ask you, well, what kind of bacteria could that be if they're gram-positive cocci in clusters? This would be a staphylococci, right? And I have to say, this picture, I do not see them. I do not see them in this picture they give us. I'm like, okay, gram stain of skin. I'm like, this is yeah, lots of rods, maybe some thin hyphae here, but really crappy picture. I was really disappointed in that picture. So fungal hyphae are also denoted upon, and again, some of these could potentially be hyphae. Again, really bad picture. Is this unusual?
No.
No, right? You have organisms, and you can have either one of these two, and usually you're not going to run into serious problems unless you've got something else going on. So Canidia albicans, or Malassezia furfur are two very common ones. You can have overgrowths of Canidia albicans that can happen. It's commonly referred to as a yeast infection. It can happen. And Malassezia furfur can overgrow in the skin and cause differences in pigmentation. So this is typically referred to as versicolor. So people who are Caucasian tend to have the pigmentation increased where it's growing, where people African American tend to have a decrease of the pigment where it's growing. So you can have infections of your skin even by normal flora that are present. So Malassezia furfur is a fungus, right? It can be found on your skin. It can grow in the yeast phase as well as in the mycelium phase. And on non-affected skin, the fungus is mainly present in the yeast phase. The organism has complex lipid requirements for growth, but again, we have fatty substances, right, associated with our skin, which explains its occurrence, right, with our skin. It also can, this also leads to the requirement for special media. And so you'll notice that when they actually do try and culture any particular fungi, they mention a particular type of media that they use to try and get the fungi to grow. And as I said, it can cause versicolor, mostly for people that are immunocompromised. Candida yeast usually live on the skin and mucous membranes without causing infection, although, as I said, overgrowths can occur and cause symptoms to develop. Symptoms depend on the area of the body affected. It can happen in the mouth or the throat. This is commonly referred to as thrush. For the vagina, we just refer to it as a yeast infection. Invasive forms can produce toxins that can enter into the bloodstream and cause serious infections. Usually, it's not a problem except for people whose immune systems are compromised. So young children, elderly, HIV patients, people going through chemotherapies may have some complications with this type. But again, found on skin, right? So it could be one of the ones that present. So it's not uncommon, right, at all to find fungal hyphae we're seeing growing on the skin without actually causing an illness. So what features of this microbe that actually do end up culturing one that's not part of the normal flora, right? So what does this guy look like? And instead of asking you guys what particular stains, I asked you, why do we stain? And so why do we stain?
To be able to visualize.
Right, to create contrast, right, to be able to actually visualize them, right? So these are the particular stains that they would use that are good for looking at fungi. So in addition, where is this organism found? So this is not a normal flora. So this is a zoophilic, which means that it's mainly found in animal species. Mice, guinea pigs, kangaroos, cats, sheep, and rabbits all have been known to carry the fungus. And one of these guys is on the list, was found when they returned back to the shop. They found mouse traps, right? And the shop owner was like next to a restaurant and below some apartments, right? So he blames them for his mouse problem. Well, of course, they were like, the minute you catch a mouse, you let us know, right? We want to test the mouse. So in addition, they went back and they tested the inks. And when they tested the inks, they also found the fungus in a different form in the inks. So when it grows on culture, it looks like fungus, right? It's that fuzzy, and it has a creamish color to it, right? Where you see the long threads when you look at it under the microscope. The arthrospores is an asexual spore, right? It's formed by segmentation or fragmentation, and their walls tend to thicken. And these are meant for dispersal into the environment for reproduction. So they get dispersed. So in the ink, is it actually growing?
No.
No, it's just dormant, right? It's just there. The unfortunate thing, once injected into her skin, now is in an environment where it could grow, right?
Lots of nutrients, yeah.
So hypersensitivity, so they say, why is she demonstrating hypersensitivity symptoms? Well, what is hypersensitivity? It means that, you're responding to something that necessarily wouldn't harm you. But it's a normal immunological response, right? In this case, it's just a really big one, but is it really a hypersensitivity? In this case, no, right? It just appears to be a hypersensitivity. It's not, in fact, a hypersensitivity. So you really got to know the cause, right, to know if it's truly a hypersensitivity. And in this case, it's not an allergen, right? So therefore, we wouldn't tag it as a hypersensitivity. It is in true an infection, but again, you're going to have an immunological response to an infection, right? Inflammation. So he prescribes a particular drug for this type of fungal infection. Protein, keratin, actually can be eaten by some fungi, and in this case, this drug inhibits the ability of the fungus to be able to eat the new keratin that's being produced. So, as the skin is growing, right, we slough off the dead keratinized cells. So the fungus also will get sloughed off. It also will not be able to continue to grow because it won't have access to the keratin, right? Because this drug is blocking its access to the keratin. So epilink, what is an epilink, right? Epidemiologists, this is the study of the distribution and spread of a disease. So how did this happen? Right? What were the chain of events that led to her getting infected?
Mouse got into the tattoo salon.
Mouse got into the tattoo salon.
It had this.
It had the fungus.
And it left it in the environment. So
Left it in the environment. Got into the ink, right? Which was then
into
injected into her, right? And so that's what we refer to that, right? In this case, how did it get where it went, right? So it all started with the mouse in the house, right? So we're not going to have enough time to get to the next one, but definitely read over that one for next time.
How PowerPoints all available on?
The PowerPoints are available, the updated one not, it will be,
Okay.
right? I'm gonna make it, both of them available now.
Were those all released like recently? 'Cause
I did do those last week.